Breaking news from Savannah. It's Annette.
And Jeanette with the K.
Sad day in this community. We haven't seen anthrax around these parts in a while. It is known to be originated in Egypt. It occurs naturally in soil and commonly affects domestic and wild animals around the world. People get sick with anthrax if they come in contact with an infected animal or contaminated animal products. Anthrax can cause serious illness in both humans and animals. Anthrax is a serious infectious disease caused by a gram-positive rod-shaped bacteria. It disrupts various immune cell function, cellular signaling, and cell migration. It triggers an inflammatory response that causes programmed cell death in affected immune cells.
There are 3 different types of anthrax, including cutaneous anthrax. This form affects the skin and typically begins as a raised itchy bump that resembles an insect bite, but within 1 to 2 days develops into a vessel and then a painless ulcer. The second type is pulmonary anthrax. This form results in inhalation of the spores. Initial symptoms are flu-like and progress rapidly to severe respiratory distress. Anatomical changes include hemorrhagic mediastinitis, which is bleeding into the area between the lungs, pleural effusions, which is fluid accumulating around the lungs, and necrosis of lung tissue.
I'm pretty sure that's what that girl got.
I think so too. Lastly, we have gastrointestinal anthrax. This is a rare form resulting from ingestion of contaminated meat. It causes ulcers and lesions in the intestines, leading to... Now we cut to our fellow reporter, Opal, who is on site at the hospital interviewing the doctor taking care of our patient.
Excuse me. Thank you, Jeanette. I am outside the hospital as we speak, about to go in and talk to the doctor. But before we go in, we're going to list a couple fun facts about anthrax. Actually, in 2001, people both got inhalation and skin anthrax from touching contaminated mail. And also, humans can get anthrax through infected animals by handling wool and other products from contaminated animals, or by even eating meat from those animals. Let's go inside.
Hello, we are back, and we are outside the room now, and I recommend if you have young children to turn away. What you might see will shock you. Come in. Savannah Local News. Can I come in with my crew? Yep. Hi, Dr. Ochter, it is.
Yeah.
How are we doing today?
Well, this is our patient, Jolene, and she's presenting with pleural effusion, meningitis, and she has spores that are entering the lungs.
Wow.
Yeah. She also is presenting with hypotension. She's currently dealing with a fever, chills, cough. She has difficulty breathing, sweating, fatigue, muscle aches. She has a lot going on. Vomiting, nausea, abdominal pain, all the works, yeah. So we decided to get some labs done, which involve her blood, her PCR, and some serological tests, which will help detect if she has the antibodies.
Okay.
Yep.
Wow.
And then we also got her a chest x-ray, a CT, and a spinal tap for meningitis.
Wow.
So mainly we're just concerned about her breathing,
Okay.
and then her spine nerve function, and then her also her cardiac function. So our big nursing diagnosis for this is a risk for hypoxia,
Okay.
as evidenced by the spores in her alveoli.
Wow.
Yeah.
Wow. Thank you.
Yeah.
Thank you. And back to you guys.
Thank you, Opal. As you can tell, our patient is in rough shape. We were hoping to get the chance to talk with her one-on-one, but I don't think that's going to happen. But we still want to give our viewers, some background knowledge so they can be aware of their surroundings moving forward from this incident. It was just a normal day at the office. The mail was going around. She opened her package and a letter and just poof, right in her face. She inhaled this, and typically people don't present signs until 24 to 48 hours after the fact, but she was lucky that office staff encouraged her to go under quarantine and get admitted to the hospital. And as you can see, that it's a great thing she did go. So next time you're going through mail or opening up a suspicious package, be aware of who the sender is. We want to make sure that, all of Savannah's population is taken care of during this troubling time. So keep Jolene in your prayers.
All right, everyone, have a beautiful rest of your day, and just remember, when you open those packages, be careful. You never know what's inside of them.
We haven't seen anthrax around these and commonly affects domestic and
Oh my God! Who is laughing?
Okay,
Stress. Atomical changes include on site at the hospital. Who got the chance? No, and Jeanette, spelled with the K.
Sadness.
Nice. Hemorrhagic mediastinitis. Stenitis.
Mediastinitis.
Hemorrhagic mediastinitis. Nobody talking.
Animals are contaminated.
Thank you, Jeanette. I'm actually out